Good afternoon, and I'm David Sweat, Deputy Director of Shelby County Health Department. I'd like to welcome you to the City of Memphis and Shelby County Joint COVID Task Force press briefing for January the 21st. Today, we are at 79,051 cases diagnosed and reported in Shelby County. That's an increase of 432 new cases today. And over the past 7 days, we have averaged 429 cases per day. That is an improvement over where we have been in recent weeks, so that's a good sign. And we've had 1,154 deaths reported in Shelby County through the epidemic so far, so that represents 14 new deaths yesterday reported. For Shelby County overall, throughout the epidemic, we have tested more than 910,000 times, and 10% of our tests have returned positive. For the state of Tennessee, we're at 694,291 reported cases yesterday at 2 p.m. So it would be reasonable to expect that by the weekend we will be over 700,000 cases diagnosed in the state of Tennessee. Locally, around us, Tipton County has had 6,268 cases reported. DeSoto County in Mississippi, 17,436 cases diagnosed and reported. And Crittenden County, Arkansas is at 4,827 cases diagnosed and reported. Other news, we are calculating the reproductive rate of the virus right now at 0.84. So we continue to be below 1, and that is actually the lowest calculated reproductive rate of the virus that we've experienced in the epidemic so far. So all of these are good news items, showing that we are having an improving situation with disease transmission in our community. We're at 5,571 active cases at the moment, diagnosed and reported, and our case rate per 100,000 over the past 7 days is 44.1 for Shelby County. We do have some data slides that I'd like to show to illustrate for you some of the progress that has been made and where we are with some of the distribution of cases. This is our epidemic curve by specimen collection date, and you can see that in mid-January we peaked and we have begun to come down in terms of the number of cases reported each day, as I mentioned. And next slide, please. When we look at the distribution of cases overall, it's been a little while since we showed this slide, but early in the epidemic, we had a much greater disproportionate impact on our Black and Hispanic communities. And now when we look at the distribution of cases across racial and ethnic subgroups, we see a pattern that is more similar to the distribution of our population. Still slightly overrepresented for Black and Hispanic residents, but not to the degree it used to be. Next slide, please. When we look at our age distribution of cases, this is cumulative throughout the entire epidemic, we still see that 25 to 34-year-old individuals represent the greatest single age range for cases, but what we see is that in more recent months and weeks, we've had an increase in people being diagnosed between the ages of 35 and 64. So those the distribution has shifted to slightly older age groups in recent transmission. When we look at our death data on the next slide, we continue to see that being 55 years of age and older is where we see the increased risk of mortality. We are at 1.5% of our diagnosed cases have been fatal cases, which is a slight increase over where we were in the latter part of 2020. But the age at which deaths begin to increase is 55 years old. And in the prior graph, we saw that there was an increased number of people in that 55 to 64-year-old age group that were being diagnosed with COVID. So we are seeing a convergence of those two curves around that age group, 55 to 64, So we're seeing increased cases in that group. That's also where mortality begins to show up. Next slide, please. When we look at our vaccination data, this is as of data that was in the Tennessee Immunization Registry on Monday, the 18th, but we are 33,687 documented vaccinated individuals in Shelby County. 14.7% of those that we have vaccinated are 75 years of age and older. And of course, part of the point of prioritizing folks who are over 75 is that the vaccine should help us lower our mortality rates in those older age groups. So we continue to do our point of distribution at the Pipkin Building over by Tiger Lane, and those will continue to operate Tuesday through Saturday for people to come in and get vaccinated. All of the vaccine appointments for January have been filled, but continue to watch Shelby.community for instructions on when we begin to open the next month up for people to schedule vaccinations. And with that, I'm going to turn it over to Dr. Bruce Randolph, our local health officer, to discuss Health Directive 17 and take questions.
Thank you, Mr. Sweat. Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the health officer for Shelby County Health Department. I want to just touch briefly on the health directive. As I stated the last time that we were here on Tuesday, that we would be issuing health directive number 17. And so we issued it yesterday to become effective on the 23rd, which is Saturday. And again, I want to just remind people that we saw that it was necessary to change the health directive as a response to the changes that we are seeing in the data. As we've always told you, that we would monitor the data and respond according to the data and how it directs us to do so. So I want to just again thank everyone for cooperating, who all did, adhering to the safety measures that were outlined in the stay at home, the safer at home health order and health directive number 16, because as you can see from the data that was presented by Mr. Sweat, that we are making progress. There is a downward trend in a lot of our metrics, and I really want to encourage everyone to continue doing what you're doing in terms of adherence to the safety measures so that we continue to make progress. So the health directive that we're issuing, as stated on Tuesday when I gave an overview, pretty much allows everything to be open. But everyone must still adhere to the safety measures outlined in the health directive. We're placing a lot of emphasis on personal responsibility because at this point we have provided you with information pertaining to measures you can take as an individual that can help protect you from becoming infected with the virus that causes COVID-19, such as wearing your mask, such as maintaining 6 feet separation, avoiding crowds, avoiding indoor settings where the ventilation is poor, and other measures. So every citizen, I encourage every citizen to go online, Shelby.community, obtain your copy of the health directive, because there are safety measures outlined in it that the individual should adhere to. and it's very important, and I won't go through those again. You've heard us mention them. However, I do want to encourage you to get tested. If you've been around someone that have tested positive, you should get tested. If you want to know if you're infected, you should get tested. And if you're under 40 and you've been around in a gathering where a lot of people have gathered, not necessarily wearing masks as they ought, you should get tested. You can consider yourself that you could possibly be infected and should take precautions to isolate yourself. Of course, if you're 65 and older, you should not go into facilities or places where people are not wearing masks because you're at risk of getting infected if that happens. In terms of services and businesses, particularly the restaurants, you are permitted to increase your capacity to 50%. Now that's 50% still need to be separated 6 feet apart, no more than 6 people at the table, everyone wearing a mask until they're actually eating and drinking. No one at the bar, no gathering, no standing, sitting at the bar, no indoor smoking, vaping, and no dancing indoors. Pretty much that is it. The remainder of the health directive pertains to schools and other businesses, daycare facilities, and you'll find it all in the health directive. So I won't take up the time going through it anymore, but open it up for specific questions you may have.
Fred Broders, Local 24.
Good afternoon. This question is for David. With the new Biden administration taking over now, since in the recent days, what realistically does the health department believe are going to be positive local changes at the local level in terms of vaccine supply, and any indication that Memphis could be one of those proposed 100 FEMA sites for vaccine distribution?
Thank you, Brad, for the question. We are still waiting to find out, just as the state of Tennessee is waiting to find out, what does the change in administration as President Biden comes into office and his team is put in place may mean for us in terms of vaccine supply. We have not had any new information yet that we can share as far as how many doses of vaccine, how it would change the number of doses of vaccine allocated to Shelby County. But we are continuing, as we have always done throughout this epidemic, adjusting our strategies and adjusting our, pivoting to what the data says we need to do or what the opportunities say we need to do. Having the vaccine available is clearly a game-changing opportunity for all of America. The problem, of course, as you alluded to, is supply. And we need more doses to come into Shelby County. But at this point in time, we've had no specific instructions from the state or federal government about how the change of administration will impact the supply allocations for Shelby yet.
And as a follow-up, David, do you just on the positive side, do you think a new administration, a new set of eyes could be a positive benefit in different ways as the vaccine distribution continues?
Well, we're always hopeful that the coordination between the federal government, state government, and county governments can be improved. And hopefully with the new team and the new administration, we'll continue to see further progress and coordination between the federal and the state and the local. It's always a hope.
Siobhan Riley, Fox 13.
Yes, I was wondering, I heard Dr. Haushalter mention a few days ago that you guys plan to partner with community leaders in the coming weeks to assist with those who may be reluctant to get vaccinated. So what is the status on that process, and why is that so important?
Well, I don't want to speak for the director specifically because she may be privy to things that I'm not fully aware of. I don't know if Dr. Randolph has other information about this, but we definitely want to overcome any hesitancy, if possible, by instilling confidence in the people of Shelby County that getting vaccinated is a safe thing to do and a wise thing to do. And so as we get more vaccine and as our points of dispensing continue to evolve, we certainly will want to provide as much encouragement as possible for everyone in the community to access it when it is your time. But I'm going to invite Dr. Randolph to come speak.
Thank you for the question. And yes, we are reaching out to community leaders, members of the faith community, medical community, and other influencers to assist in getting the message out. We're in the early stages of that process because we're still trying to determine exactly how much vaccine we're going to have available, when it's going to be available, where, etc. But we'll begin, and I've had some communications with some of the ministers and pastors in the county and also healthcare providers. And one of the initial steps that we have taken, I myself, and you may have seen it posted on our website or somewhere, have received the vaccine to primarily demonstrate that I have faith in it, that I believe that the data that we have available currently indicate that it is safe and effective. And I wanted to let the citizens of Shelby County know that I'm not going to ask of you to do something that I myself would not do. And so therefore, I received the vaccine, had the picture taken, and instructed our public officer, information officer, to distribute it so that the citizens can see that we're, at least that I'm, quote, practicing what I preach. Is there a follow-up?
Yes, we also continue to hear across the country that African Americans and Hispanics are getting COVID vaccines at lower rates. I heard someone mention something about that earlier. Can you kind of go more into detail about what exactly is happening locally with the numbers?
When you speak of lower rates, what are you referring to?
Well, getting the COVID vaccines, basically we're hearing that fewer African Americans and Hispanics are getting the vaccines compared to whites. And I'm just trying to figure
okay. You mean in terms of when you look at who have received the vaccine currently?
Yes.
Okay. Well, one of the things in Shelby County, we're still in phase 1A, and 1A1, 1A2, and those 75 and older. When you look at the demographics of individuals in those particular categories, would explain some of the differences you see in who's getting the vaccine or not. I mean, in general, you would find that in the healthcare workers, African American and other people of color may not be well as represented as employees. But more importantly, I think that we don't have enough data yet. I think once we look at the broader population, we would see who are receiving the vaccine and not. You know, there's been a lot of talk about the reluctancy of the African American community to receive the vaccine. Personally, I think that may be a little exaggerated. I think what is needed is an appropriate message by the appropriate messenger that provides truthful information where people can understand it and it presented in a respectful way. And I think people will make the decision to receive the vaccine. It's been my observation that you've pretty much got three types of people. One who readily will take on a new innovation, whether it's a new vaccine or what have you. That may represent 23% of the population, 25. Then you got 15, 20% who probably will not ever receive the vaccine. And then you got anywhere from 50 to 60% in between who will receive it after a period of time. Some will wait and see. Once you provide more information, then they would make a decision. My message to the fellow citizens of Shelby County is to become informed. Read about the vaccine. Do not rely on what's posted on social media, but go to the CDC website, go to the FDA website, obtain the fact sheet for recipients and caregivers. Read that document that pretty much explains what an emergency use authorization is, so that you yourself would know exactly what you are consenting to in terms of this vaccine. In it, it explains the side effects. Even you can find out what was the results of the studies that allowed the FDA to feel comfortable in submitting, issuing an emergency use authorization. Is there another question?
That was a follow-up. Kelly Roberts, WMC.
Hey there. My first question is about second doses, those waiting for them. I believe Dr. Haushalter said on Tuesday during the last briefing that word may be out by the latest today about a site that would be set up for those waiting for second doses. Any news on that front, those waiting for the second dose from y'all?
We're still in the process of negotiating the terms of that second site, and we will be releasing it as soon as all of those details are worked out. But yes, we are working on a second site that will be designated for the second doses. Is there a follow-up?
Thank you. Yeah, and this is kind of a follow-up to Brad's question about just what's happening in Washington, especially today with several executive orders expected to be signed dealing with the pandemic. I know that how it will affect us here in Memphis is really kind of up in the air at this point. But when talking about those federal community sites that Brad did bring up and that are mentioned in some of these expected executive orders, is that something that you guys would welcome to Memphis? Is there something about Memphis that might make it particularly good to have one of those sites in? What do you think about this idea here locally?
Well, of course, we would welcome any assistance that's going to help us vaccinate our people. I mean, you're looking at 650,000 people that need to be vaccinated, and the sooner we can do it, the better. The sooner we get 70% of the people in Shelby County vaccinated, certainly, hopefully, we'll be able to, would mean the sooner we can return to doing some things that used to be normal. So we would welcome that. Of course, as Mr. Sweat had indicated, we don't know the details of anything yet in terms of what the federal government plans are. It would go from the federal government to the state and then trickle down to the county, and then we would certainly implement it. We tend to adhere to the guidance of the CDC and the Tennessee Department of Health, so we will wait on their guidance.
Jacob Steimer, Memphis Business Journal.
Yes, thank you. Either one of you that wants to answer this, I know the state vaccination data might not be 100% perfect, but right now Shelby County appears to be dead last in first doses per capita. Total doses were way behind the average. Davidson County, Knox County, 60% above us. I'm curious what's going on.
I'm gonna let Mr. Sweat answer that. Yeah.
Yeah, I'm not sure that I have not studied I don't know which data you're looking at. I've not studied other communities and how they're doing. I've been focused on us. But what you have to keep in mind is one of the things that Dr. Haushalter has talked about before in press briefings here. Shelby County has the greatest population in the state. There is no county more populous than ours. And so a small county can very quickly get a very high percentage of their population vaccinated because there's not very many people there in the first place. So part of when you're looking at a percentage basis or a per capita basis, you have to factor that in a little bit. And some of the other communities, they've been able to go to the next phase because they saturated all the people in 1A1 that wanted the vaccine, so they went to 1A2. Then they saturated everybody in 1A2 that wanted the vaccine, so they moved on to the next group. We are still in the process of vaccinating people in those earlier groups because we have, first of all, one of the things we have is a medical system here. We have a lot of hospitals. Many counties in Tennessee do not even have a single hospital. We have multiple hospitals. So we've got a lot of healthcare workers. We also have a lot of other healthcare infrastructure in our community. We are blessed with that. But that means that there's a lot of doctors, a lot of nurses, a lot of people who work in healthcare outside the hospital setting that are in the 1A2 group. The population of such individuals here is just much greater than what it is in other places. And yet, we are still also constrained to deliver the number of vaccine doses that we have received. And so I'll just speak to a couple of the things that comes up to us in various emails and phone calls from the community. Why aren't you using the pharmacies? Why aren't you doing, whatever? And part of the answer is, well, we don't have vaccine for those sites to use. If we had vaccine, we could certainly open it up and allow people to be vaccinated through other channels. But since we don't have the doses, then there's not much we can do. So, what I can tell you is we haven't wasted any doses, and we are using all the vaccine that comes to Shelby County. We have stabilized with the state the expectation of the number of doses that will flow on a regular schedule, so we're making that more routine. We've been able to set up the Pipkin building for the health department. The hospitals also continue to receive their allocations of vaccine and continue to provide immunizations as well. The VA system is doing something similar, but we're not sure what their data is because they're in a different data system. And so I don't know how many people have been vaccinated through the VA system at this point. It's a federal system. And then we do know that pharmacies have received some allotment of vaccine, and they have agreements with nursing homes to vaccinate folks who are in nursing homes. So there's a multi-channel effort going on in this community to vaccinate people. And everyone, I am sure, is doing everything they can do to move that vaccine into people as expeditiously as possible for each of us to do.
Yeah, I guess the size thing doesn't make sense to me since Davidson County is one of the leaders according to the state data. But Dr. McCullers told me that the state is shortchanging us on the number of doses we're getting. Do you have any idea why that's happening, or if there's a local effort to try to lobby the state for more doses?
We certainly lobby the state for doses and advocate for our community. You would have to, you'd really have to point that question back to Dr. McCullers, because I'm not sure. I don't want to speak for him. He's not here to help answer any questions, and he and I have not had a discussion about what if he said that to you. He and I have not discussed it, so I don't want to speak to it.
You're out of time. Are there any closing messages today?
Just, we want everyone to stay the course. The numbers are improving. We are down to an average of 429 cases per day, but that's still a very high number of cases per day. We are below 1 for RT, but we're still producing cases, and transmission is still going on in the community. In the next health directive, we are relaxing some of the restrictions from the previous health directive in response to your good efforts. And that is something that we should all be grateful for and applaud each other for your cooperation. But we still need everybody to wear a mask. We still need everybody to wash your hands, to practice social distancing. As soon as you're able to get vaccinated, please do that. And in the meantime, take care of yourself and others by getting tested if you have symptoms. Don't go to work if you have symptoms. Find out your status, and then isolate yourself as appropriate. Thank you.
Thanks, everyone. We'll see you back here next week.